Mahalo Lele, and welcome back to the second part of the Pacific Health Talanoa with Lorenzo on Blue TV. Thank you so much for tuning in. Talo Falava, kia ora ana, malo opito, and a massive kia ora to our whānau out there who are tuning in and acknowledging all our frontline workers, essential workers. If you are tuning in from from say the supermarket, serving our people, or if you're tuning in from a testing station, testing our people with COVID-19, or even giving them their vaccination. Massive shout out to you from Pacific Health Talanoa with Lorenzo. My second guest today, she is a very special tahine. DanaRae Pila is a proud Tongan who was born and raised in Central Auckland, Onehunga, Royal Oak, Epsom, and Mount Ruskell. She now lives in South Auckland with her husband Pila and their 7-year-old son Viliami Eke III. As a health coach based in the Doctors Onehunga, she supports whānau living with long-term conditions to make healthier lifestyle choices with particular focus on increasing physical activity, quitting smoking, managing stress, diabetes management, and sleep hygiene. So joining me on the show today is Tahine Voilole DanaRae. Thank you so much for joining Tahine.
Malo Alpito Lorenzo. It's lovely to be here, and it's just nice to catch up with you and finally catch up and see how you're going with all your great work that you're doing, keeping busy and keeping our community informed.
Thank you, DanaRae. I know you're a very busy woman. Been trying to track you down for the last 3 weeks to have a Talanoa with you, but finally I've got you on a show. So tell us a little bit about yourself first before we get into our Talanoa, DanaRae.
Okay, so like you mentioned before, born New Zealand, proud Tongan, New Zealand born Tongan, born and raised in Central Auckland, and currently living in South Auckland with my husband and his family. And we have a 7-year-old son, and am currently working as a health coach at the Doctors Onehunga with ProCare. So been in that role for nearly a year and really enjoying it. Was doing smoke-free practitioning, so really enjoying that as well. Just good to be back in the community serving our people and making sure that they are generally living a healthier lifestyle, and just to tautoko and support them along the way. Yeah.
Thank you so much, DanaRae. I'm aware that you also, work in the public sector for Immigration New Zealand for many years. And has it always been a dream of yours to become a health coach? I'm also aware that you spent some time working in the central government, but now you're working as a health coach. I mean, how did you find yourself, becoming a health coach?
Well, it was actually by default. Like you said, was in MBIE for up to nearly 10 years, and then made the big shift into working in the NGO sector, and then getting to the parliamentary services with the government for a year. However, it was a very busy sector to be working in, and I wasn't looking after my health as much as I should have. And so that was a big wake-up call for me to be sick in Hamilton, in Wellington, and not having my family there. So that was the main reason to get back into the health sector, was to look after my health and also my family as well. So that was the reason why the big change from real, at that sort of level of work to more community driven, which is really a big change, but a welcoming change, I must say.
Thank you, DanaRae. And what is a health coach? What do they do? What do you do in a Doctors Onehunga? And I'm pretty sure there are also health coaches that are working at other clinics as well. So what does a health coach do, DanaRae?
Okay, so basically, our role as a health coach is non-clinical. So I'm not a doctor and I'm not a nurse, but I'm also that bridge in between that can help that the patients that we get from warm handovers from our doctors in the clinics to just support them into actually understand their medication management, also look into just the journey that they take, setting goals with them, so that we can journey with them in their health journey to make better decisions for their lifestyle that they're living. So it is really a lived experience sort of role, because it's non-clinical. However, we are in it's a new way of supporting our people, especially the Māori and Pacific, at the GP clinics, because it's a warm handover of patients to our, not only us health coaches, but to our health improvement practitioners, which are more mental health services. And so we just support and help the patients navigate to connect also to social services that might meet their needs. And so it's a relatively new model that was piloted in 2019 by ProCare. And because of the amount of population health or people that were requiring this service, there is many more. For example, in the organisation I work for, there is up to, I think, 800,000 patients here in Auckland, and 100,000 of them are Pasifika. So we are wanting more health coaches in our general practices, and it's a new way of working now. General practices have been running for over 100 years since, doctors have been serving the community. So to have that extra support there that is non-clinical, non-judgmental, but also there to support their journey and their well-being is vital, I believe, in all practices.
And it's culturally designed as well, is that right? Oh,
it's culturally designed, and I think it's a more holistic approach to the way we, as Pasifika and our tangata whenua, serve our community and our whānau.
And so how has your role been so far, with the response from our people that are walking into the clinic, seeing the nurse, seeing the doctor, and then just before they walk out, they'll be like, oh, hang on, I think I need some more information about my diabetes management. I think I need to be referred to a social service. I need to see a health coach. How has the response from our people, been like?
It has been, it's been awesome, but, it is still a new way of working in general practices. So what we want to see is the warm handovers being done so that the patients can, because some patients, they won't be able to communicate to some of our colleagues, such as doctors and nurses, like they do with us health coaches and health improvement practitioners. Usually the consultation with the GP might be up to 15 minutes, whereas with a health coach, we sit with them for a one-on-one for up to 15 to 30 minutes. And sometimes language is a barrier.
Another barrier.
And so that's another bonus for us Pasifika health coaches who are serving our Pasifika community. And we understand the way our Pasifika families live, because we are Pasifika. So we also have to, I think it's just, we're adding value to general practices with the way that we communicate with our patients.
Wonderful. I love that. DanaRae, and I've known you for many years, and that's just who you are. You're all about supporting and helping our elderly, especially elderly people whose English is very limited. And with you being fluent in Tongan, pretty sure the Doctors Onehunga is very blessed to have you. So what are some of the ways, we are now under level 4 lockdown. It's been extended for another 2 weeks. What are some of the ways or some of the things that our people can do at home to manage their health better,
It's life.
especially long-term conditions?
Sorry, Lorenzo, I just had my sister-in-law. I couldn't really hear that question. What was that question? Sorry.
It's a Carmel Sepuloni part 2.
Blame it on
Anyways,
Tuifua.
yes. What with us being in lockdown level 4, for another 2 weeks, and
Yep.
some of our elderly people are very scared or afraid to
Yes.
go to see their
Yes.
doctors, under
Yep.
level 4. So, what are some of the things that our people can do at home during level 4 lockdown to manage their health better, especially their long-term conditions?
Absolutely. We're all about a hauora, or just the well-being of our people. And we know our Pasifika elderly, and we know our Pasifika people. So the communication, like for example, this interview, and also the radio programs, obviously I'm not doing face-to-face consultations, but just being on the phone constantly with them. And that's the beauty of lockdown. The consultations might be longer than 30 minutes. So I'm going to be talking to my 70-plus-year-old Tongan patient for up to an hour, because he wants to share with me about a particular vai or medicine that he's mixing, which is fine. But that's the beauty of communication technology, really. We have green prescription that do online, which you can self-refer, or I can refer our patients to. And if it's, if the elderly or some of our people aren't very tech savvy or into that whole, not really knowing if they don't have any grandchildren or children that live with them, just the weekly, even if it's two times a week phone call, that communication that I as a health coach can do with the elderly patients is I think very important, because we also can refer them to our colleagues who are so for example, in my clinic, I have two health practitioners, and these are clinical, like psychologists, counselors, therapists, occupational therapists, social workers, or nurses, and also doctors that want to work as health improvement practitioners, So very, very fortunate to have these colleagues work alongside me. And if I feel that, or the patient feels that, you know what, Dana, my mental well-being is taking a toll. This is taking a toll on it. I can just directly refer them to my colleague, just like that, because we're in lockdown, it's going to have to be a phone consult or a virtual consultation. But if we were in the clinic, it's just the next door. So another adding value to the way general practices run is having health coaches and health improvement practitioners, or HIPs, there in the clinic, to serve. Yeah.
As a health coach at DanaRae, and I see in your in your introduction that you also help people to quit smoking. What would be your advice to to our people who are smoking and struggling to quit, or they are relapsing because of the stress and the depression on the level 4 lockdown, and also some of our people who are struggling to maintain their weight, like me? I've probably put on 5 kilos in the last 2 weeks. What would be your advice, DanaRae, as a health coach?
Well, it's more around the education around it, really getting down to the nitty-gritty and explaining to them, what is in that cigarette. Yes, we are addicted to nicotine, but all of the other chemicals that they use to make that one cigarette is poisonous. And so, we've got to change the routine during the day. If they're waking up and going straight to the coffee and the cigarette, let's change it to a fruit smoothie instead of a coffee, and have just enjoy the fruit smoothie and sit outside and on the deck and enjoy the peace and quiet before you start work, instead of that cigarette, you know. So there's a lot of things we can get into with the smoke, trying to reduce your smoking and eventually quitting. We do have our service, Ready Steady Quit, available as well during lockdown level 4, and it's just a matter of changing the way that we
The habits.
operate, and that we, you know, and it's a way that we try and maneuver our way through life and our health to be better. But we just have to be more educated around that sort of thing as well.
Wow, thank you so much, DanaRae. Last question is, what would be your advice for our young people, you know, our youth who are still struggling to find what they want to do, or what the sort of careers that they want to pursue, moving forward from Mole DanaRae?
You know, find your passion in what you want to do in life. If it is, you know, cooking, you know, in the kitchen, you spend a lot of time in the kitchen, like myself, you know, just go for it. You know, the sky's the limit, and there are so many organizations available, and you know, you are covered with all our prayers, you know. And I think our young people have got so much potential, and they just need to really focus on what they want to do, what they feel is going to be helpful, and also, you know, respect and a smile will get you a long way. And so be kind and show empathy wherever you go, and just really enjoy what you want to do, okay, and enjoy what you want to do in life, because if you don't enjoy it, and it's not for you. So find something that you enjoy, that you are passionate about, and just go for it.
Thank you so much, DanaRae. And I just want to add to your comment that for our young people to really ask for help, ask for support. Don't be afraid to ask. There's heaps of resources and support available out there. There's scholarships. There is apprenticeship opportunity. There's a lot, but it's up to us, to go and ask. Ask someone like DanaRae, who can refer you to the Ministry of Social Development, or to Work and Income, or to some of the education providers, to get that support. And if you need any legal advice, go to the Mangere Community Law Centre, go to the Otara Community Law Centre. It's all free, DanaRae?
Absolutely free. There's the Doko Collab group that look after our young people and their hauora. And they've been running for a number of years now.
Wow.
And so, again, reach out. We've got these wonderful organizations and these wonderful people here in the community. And it doesn't necessarily have to be a community leader, but someone in your circle or in your church or your youth group that you trust, and that they are genuine, and just seek help, seek advice. And those people, like ourselves, Lorenzo, we can advocate for our young people. We've been there. We've done that, really.
Yeah, we used to be noodle eaters back at university, so we've been there, done that.
We used to hang out at the pod.
But DanaRae, thank you so much, my sister, for coming on the show. And it's good to see you.
You're welcome.
Great to have you in the health sector, advocating and supporting our people. So thank you so much.
It's been a pleasure. Malo apito. Malo apito, Lorenzo. Ofato tonight and the kids.
Ofato.
Malo.
DanaRae, health coach at the Doctors Onehunga, having a kōrero and a Talanoa about her role. Wow, what an amazing Pacific leader is, offering and giving that support in a clinic setting. So I'll be right back, with my updates of COVID-19 after this break. See you right back.
sense. Oh, say I'm say you are complete to me, I get you. By the way that you move and the way that you smile. Say, oh my Dorima, baby, you be giving your hand, I'll take you anywhere. You give me something that I never had. Cause you care, but about to me and the family. Say, why you waiting on me to talk to you? Yeah, I'ma listen what y'all say. Yeah, don't move out in the come here. Yeah, they on the layout, oh, dirty wine, girl, dirty wine, yeah. Say, tama in, and not the bite, say,